Your
Thank
time
you, sir.
starts now. Over to you, sir.
Good afternoon, everybody.
Of 29-year-old female who have undergone PKP for advanced keratoconus in the right eye 5 years ago. She presented with poor vision, opaque graft, extreme ectasia, and thinning of both the host cornea and graft. It was impossible to rehabilitate as both PKP and DLK were not possible. Suddenly, an idea struck. Why not combine the two, peripheral DLK and central PKP? Partial corneal trephination was done using an 11.0 millimeters trephine.
So these cases are very difficult to manage because both host and
The incision was deepened. Lamellar dissection was initiated using a Poffitt knife.
and the lamellar dissection in thin cornea is extremely difficult. So we use all instruments which are available with us.
Lamellar dissection was performed using a lamellar dissector and corneal scissors.
Peripheral, very thin cornea, several procedures have been described, but in this case we thought we'll try to do the lamellar dissection as deep as possible so that we can put the donor graft, and we have
the
to
lamellar
take
dissection was completed up to the host graft junction.
And once we have completed that, we thought we'll put some fibrin glue so that
Fibrin glue was put on the lamellar dissected corneal surface.
these are the two components of the fibrin glue. And once we put the second component, after waiting for a minute or two, you can see that the fibrin glue has polymerized, forming a gel. We wanted to make sure that the peripheral lamellar corneal graft
AC
area
was entered at host graft junction with 15-degree knife. Opaque graft was excised using corneal scissors.
because there was no other way to take care of this patient when there is extreme thinning of the peripheral cornea
A full
along with
thickness
ectasia.
donor corneal button 11.0 millimeters was secured. monofilament interrupted sutures were used.
We do use continuous sutures in cases where we are doing penetrating keratoplasty or lamellar keratoplasty of 7.5 millimeter diameter. When it comes to the very large corneal grafts, like in this case, we want to be very sure of the apposition, so we have chose to put interrupted sutures along to make sure that there are no areas, weak areas, where we have to
Corneal topography showed significant flattening.
OCT shows that the lamellar part is well adhered, and topography shows that the cornea has flattened in the central part, and we could achieve
The
good
patient
results.
had a clear graft and achieved 624 BSCVA. It was like conquering an indomitable peak in the Himalayas.
Thank you.